everyone, I'm Katie and I'm one of the hearing care assistants here at Audiology Associates.
And my name is Rhys, I'm one of the audiologists here at Audiology Associates. So we got a joint effort on this one.
We have.
So Katie started this one off. It was a difficult one,
It
this one.
was. It was tricky.
Blinking heck. It was a tough one.
I didn't actually notice how tricky it was going to be until, obviously, when you do the first initial look, you're lifting the ear up yourself.
Yeah.
I was like, okay, but as soon as I went in with the two tools, I was like, oh,
yeah,
that's a narrow one.
It is. Because we always put a bit of pressure. So we hold on to the top of the ear and pull up and back to just open that canal out. But you haven't got that, because you've got a tool in each hand, you haven't got that ability when you're inside the ear canal view.
It is tricky, but and I was trying to like push it open, but I just haven't got like the knack of it yet. Do you know what I mean? And you don't know how far to go in to then pull it open before the patient start winces and cause them a bit uncomfortable. But
it can be, because what we try and do, because obviously the tools we've got a straight on there, so you're trying to go in with a straight tool and we're pushing the bits out of the way just so we can get into the ear canal basically. But a lot of the time what I do is I pull up and back on the ear first, then I pop the endoscope in and kind of shove everything to the side, and then I'll go in.
Okay, so already like pre-planning your...
You got it, that's right. So just kind of move it out the way so you can just get... But it is like here now, absolute nightmare, because you've got such a straight tool trying to get in there, and it's, you know what I mean, it's so difficult to do.
Yeah, like it looks like it's, that's, it's right on the outer portion, I'll get that nice and easy, but no, you could also see the consistency of it as well. It just couldn't get the grip. And I didn't really want to put oil in because it's so close to the opening. Yeah. Everything would just be like a big...
You got it. It would just fit. So the thing is, when you look at the ear canal like that, it's just going to fill the gap. And as soon as you try and put an endoscope in there, it's just going to blur the camera. I
was like, no. So, creating little gaps, but... Yeah. As I was doing it, I thought, I'm not sure if this one's going to be done today.
You never can tell with the dry ones like this, because they sometimes they'll be rock hard, and other times they'll have that kind of slightly, almost like a clay consistency. So you never quite know what you're going to get. See what you do with the rose and insert, try and nip down the side there.
Yeah, I thought get like the little one.
Yeah.
A nice little thin to try and hook it in, but...
Yeah, the reasoning behind it is sound.
Yeah, but you know me and... manual tools, not quite to standard.
They're kind of quite a fine art with standard tools, because when you're doing curettage tools, it is a totally different way of taking that wax out. You've got to be conscious of the pressure, the canal walls. Everything changes when you use the manual tool.
The actual position of yourself is different as well.
Yeah, massively.
You can't just go in like straight like that. Like I always got to find I put this hand up a lot higher. Yeah. To try and like get a scoop, but I'm getting there. Slowly but surely.
It's funny. I tend to sort of. Like with most things, I'll use like a pen grip, but with those, I almost like use my middle finger. So where we've got those nice kind of angular Rye tools, I'll use almost like that. Always sort of, I can maintain my bridge there, and just a little bit of pressure. It's that kind of movement. Okay. Yeah, it's a funny one, but. I think I'm gonna go,
but you know it's going to be tricky when I get a manual tool because they are the very last resort.
Nothing else has worked. Let's get a manual tool in there.
And if it's manual tool, then no, it's going to be sauteing then after that. That's how I go.
The thing is with this one, it's a difficult one because the canal entrance is narrow. So when you're trying to get in there with a manual tool, you've got the complication of with a suction. You're kind of working along it, you're lifting, and you're kind of working at the front of the wax. So it's a little bit easier with a narrow canal, I find. But with a manual tool, you're working behind the wax and bringing it forward. Well, you're already holding part of the canal open, aren't you? With trying to get that through. So it's not easy.
No, and like with this certain like type of wax that this patient got as well, I noticed that it was like starting to like crumble a little bit. I didn't want like pick. And then obviously I'm getting further down then, and the tools are then more difficult. To get further down in the canal then, but...
And you can see here you're having to drop back with the endoscope a little bit to accommodate the tool in and to get the angles you need for the tool, and then you're letting go of that part of the skin here on the outside, and the canal then is coming back in on itself. Yeah, it's not easy.
No, but this video is very much chaotic really, because I'm in out.
You do though with a lot of narrows. I'm the same, because a lot of the time it forces you to use sometimes a smaller tube. They just block so easily, so you are kind of in, out, clear the tube, in, out, clear the tube constantly. Yeah.
So I'm just literally, I'm trying everything I've got.
I can see, I think I see the right hook. 4/7's got in there. It's going to be dynamite next. That's the last thing.
Just dive in myself and pick it out.
Your fingernails is probably over there.
But no, it was a really tricky one, and I was working on it for quite a while, but obviously you've got to be careful then, you don't cause too much uncomfortableness for the patient. Then, if you're constantly poking and prodding around in there. Because
the thing is, although you're not pressing on the canal wall, you'll have a certain amount of irritation just for that wax moving around in there as well.
Yeah, but, and where it was, I obviously just a bit further back as well, the patient kept coughing.
So you were hitting the Arnold's reflex. Yeah, okay. And then you kind of, it's always the same when I've got somebody with a really strong arm. I'll just get a grip on the wax or just get to the button and they go, and then you're like, oh no, everything's moved. So it is difficult. It is
really difficult. You've got to pull out there and they say, oh, I'm going to sneeze, and I'm just like, oh God, here we go.
It's all going on. So, yeah, I've got some patients and they've like, I got one chap I can think of, and his ear canals are really, really difficult to do because they're quite hairy, and it's always a very, very thin layer at the bottom of the canal. And then his cough reflex is so strong that you just got to get even close to it, and then the coughing starts, and then you kind of in all the hairs again. And, but you cleared the one side though. That first side's out.
Took 5 tools, but we got it.
She used everything in my arse.
5 tools, half hour, we got it.
Stuck in a little backpack with them all in. It's like pulling them out like that. We ought to get Taylor Green. You ought to give him like a little like a golf caddy. You could just stand by the side where like pass things to. You take a little sock off the top. We're gonna go.
You could see the patient like looking like, what's she going to do next?
But it's, you don't want to clear that because they're not easy ones. And when it's rock solid, like I'd say that was more of a clay type wax.
Yeah,
the first
definitely.
One. This rock solid type of wax like this. Oh my goodness, they are so hard.
Yeah, and this is on the left hand side as well, which I always find harder than the right anyway, because you've got to go round the bend. You're
kind of almost working against yourself a little bit. Yeah.
But then sometimes it's a bit easier because you can push it open with the suction tube then. Yeah. So that's a little bit easier there.
Yeah.
But
you find it with patients when we fit hearing aids as well. They'll always say, oh, I can get this one in really easy, but I really struggle to get this one in. And it's always the angle. I know we were talking about the other day, that upside down gun.
Yeah.
I've used that quite a few times. So if you are in difficulty inserting your hearing aids, especially the what they call the receiver in the canal aids, one with a little rubber tip on the end, they recommend using an upside down gun. So imagine that you've got this kind of, like you're left and right now that people use, but you put them upside down and push, because you are getting the better angle to get it around, because people don't realize you got to get it round that out a bit of the ear canal.
Yeah, I remember I had a patient and he was like, oh, I think both of them are in, but I can't really hear well. He said, is it in? And he was like, poking. I was like, no, it's not quite in yet.
Have you ever had someone put them in the wrong ears?
Yeah,
I've had that a few times. Yeah. That doesn't really seem to be working. And when you look at it, it's the kind of they're sticking out like little cat whiskers to the side of the
head.
Yeah, it does happen.
Yeah, this one again, tricky.
Not an easy one, this one.
The other plug was more like oval shape. Yeah. This one's just like a big chunk.
Yeah. And when you're trying to hold that back and trying to pull, the thing is, when you look at the surface, you've got that kind of knobbly sort of surface to it. You can't really get a fantastic suction grip on that. It just doesn't work very well.
No.
And when you've got no wiggle room.
No, you've got no way to like give it a little bit of.
No. It is literally against the sides of the canal wall. So normally we detach it, wouldn't we, from the canal wall and wiggle it around. But when it's like that, it just, especially when it's a solid block like that, really hard to do.
You can't do your clockwork with them.
No.
That's how I always work.
Yeah, work your clock face. Yeah, definitely. We use that a lot. You're looking for a otoscopy. We started 12, would be on an old analog clock, 12 o'clock, and work your way around. And the same with wax removal, I tend to sort of work the edges and then try and pull.
It is so much easier when you do like that, obviously, because when I first started out, I was just like trying to aim for the top left and bottom left, right corners, but definitely is a lot easier when you're working like a clock.
Yeah. I've seen people of mine when they first start off, and you'll see them and they just go dead centre to the wax. They stick the dead centre and they just kind of do this, like hoping the wax is going to move, but it doesn't quite do it, because you'll chip away at the centre, but you won't pull the sides away, and that's what's attacked.
Like sometimes I've noticed as well, it like bulges it out, and then kind of like fill it up even more.
You got it. So we've got right hook. No, it's right curette. I always say the wrong thing. Difficult, isn't it, to get above there.
Yeah, but it's easy, like, creating you could see how hard it is. It's not budging. No. Like, even when you, like, try and push the...
You're doing all the right things, because, you went in with the right curette, and there was a gap, but not quite the angle to get over the top. Using the right hook then,
Yeah, because the right correct is a little bit scooped anyway in itself,
Yeah.
but it wasn't just...
Now, see, a lot of Jobson horns aren't, see, a lot of the Jobsons, because you only ever use the sort of Rye and the oval, no, I don't think you had those, just the Rye tools.
Yeah.
But the old Jobsons, you'll see Taylor use them sometimes, and they look like a thick circle on the end.
Okay,
That's a standard Jobson.
Right.
I don't like those. I think they're good for really, really soft wax, but not much else. I'll tend to use what I used to use was the oval Jobson horn, because it had a slight sort of almost came to almost a point at the end.
Johnson was
And this one now is with the Rye curettes. They have got a little bit more of a point, a little bit more of an angle to them. They're a bit handier to use. Good idea here though to pull on the skin.
Yeah.
That was really good.
It's just you got to be like gentle in how you put it, so obviously don't snap off. But I thought I'll just grab like a meaty part by
look at that. That's a good chunk.
Getting good on the old after shots.
Look at that. Nice and clear as well.
There's nothing better when you go in and it's all clear.
It is lovely. Perfect.
What are we, 1.5?
I'm going to go with 5/8 of an inch on that one. There we are. Well, guys, thank you very much for watching that video. If you do enjoy the videos and you're watching this on YouTube, there will be another recommended video that comes out up here. If you're really enjoying the wax, and we'll also make sure it might be on the other side. I can never remember which way, but it'll be one of the one over there somewhere. But as always, guys, if you do enjoy the videos, then you can always like, heart, share, follow, and subscribe for me. That would be absolutely fabulous. If you thoroughly enjoy the videos and you want to see even more, become a member of the channel. You get to see even more videos then as well. But in the meantime, guys, as always, take care of yourselves.
Take care of your ears.
And take care of one another and myself. And lovely Katie. We'll see you again soon. Bye, everybody.
Bye, guys.